Raw milk has become a genuinely polarizing topic. Advocates describe it as more nutritious, more flavorful, and more natural than pasteurized milk. Critics, including the FDA and virtually every major public health organization, describe it as one of the higher-risk foods available to consumers. Social media has amplified interest in it significantly, and questions about whether you can at least cook and bake with it safely have become common. Here's what the science actually says about raw milk, what happens when you cook with it, and why the nutritional claims made about it do not hold up under scrutiny. Start with the fundamental safety picture, because it is more serious than the raw milk discussion on social media typically acknowledges. Raw milk is milk that has not been pasteurized. Pasteurization is a heat treatment process developed in the 19th century that kills pathogens by heating milk to a specific temperature for a specific duration. The standard HTST method, which stands for high temperature short time, heats milk to 72 degrees Celsius for at least 15 seconds. Ultra-high temperature pasteurization heats it to 138 degrees Celsius for 2 seconds. Both methods kill the bacteria responsible for most milk-related foodborne illness. Raw milk does not receive this treatment. Multiple harmful bacteria can reside in raw milk from healthy-appearing cows, including E. coli, Salmonella, Listeria monocytogenes, Campylobacter, and Brucella. These pathogens can be present in milk from animals that show no signs of illness. There is no way to determine whether raw milk from any given source is contaminated by looking at it, smelling it, or tasting it. A 2017 study published in Emerging Infectious Diseases found that raw milk accounted for an estimated 96% of dairy-related foodborne illnesses, despite representing a small fraction of total dairy consumption. That proportion is stark. The vast majority of reported illnesses from dairy products come from the small percentage of dairy consumed in unpasteurized form. The FDA specifically warns against raw milk consumption for the elderly, pregnant women, immunocompromised individuals, and children, all of whom face more serious consequences from Listeria, Salmonella, and E. coli infections. Now for the cooking question specifically. When you cook or bake with milk, many recipes reach temperatures well above those required for pasteurization. Heating liquid to 72 degrees Celsius for 15 seconds kills the relevant pathogens. Bread baked at 190 degrees Celsius reaches well above that. Sauces, custards, and soups cooked to a simmer reach temperatures that exceed the pasteurization threshold. In these circumstances, using raw milk in a recipe and heating it thoroughly is technically making it safer in the process. The cooking itself functions as a form of pasteurization for that milk. However, there are significant practical caveats to this reasoning. Not all cooking applications bring the milk to a safe temperature uniformly. Recipes that use milk cold, like whipped cream, cold sauces, certain no-bake desserts and beverages, would involve no heat treatment at all. Even in cooked applications, the distribution of heat through a mixed batter or sauce introduces variables. Other ingredients may insulate portions of the liquid from reaching the required temperature. Cross-contamination between the raw milk and surfaces, utensils, or other ingredients before cooking can spread bacteria to components that will not be heated. If you are baking with raw milk, but tasting the batter before it goes in the oven, you are consuming raw milk. The responsible guidance for anyone who is genuinely concerned about food safety is to use pasteurized milk in all applications, cooked or otherwise. The cooking argument for raw milk safety is not wrong in ideal conditions, but the variables introduced in real kitchen environments make it a less reliable protection than simply using milk that has already been safely processed. Now for the nutritional claims, because this is where the raw milk conversation frequently starts and where the science is most clearly settled. The primary claim made by raw milk advocates is that pasteurization destroys beneficial bacteria, reduces nutritional content, and produces an inferior product. An FDA review of the scientific literature reached a different conclusion. Unpasteurized milk does not contain beneficial bacteria in any meaningful or reliable quantity. The bacteria present in raw milk are overwhelmingly environmental contaminants from the animal's environment and digestive system, not a curated probiotic community. The idea that raw milk contains beneficial bacteria that pasteurization destroys is not supported by the evidence. On nutritional content, pasteurization does cause very minor changes in some heat-sensitive nutrients, primarily a small reduction in some B vitamins and vitamin C. However, these losses are minimal, and milk is not a primary dietary source of either nutrient to begin with. Protein content, calcium, vitamin D, vitamin A, phosphorus, and most other nutrients in milk are essentially unchanged by pasteurization. The nutritional profiles of pasteurized and raw milk are, for practical purposes, the same. The flavor argument is the most subjective and therefore the hardest to definitively dismiss. Raw milk advocates describe it as creamier and more complex, with the cow's diet expressed more directly in the flavor. This may be true for some people and not others. Blind taste test results are not consistently favorable to raw milk. A New Yorker comparison identified pasteurized milk as creamier. Other blind comparisons have found pasteurized milk thicker and sweeter. Flavor perception varies substantially by individual, and the subjective preference argument does not constitute a nutritional or health justification for accepting the documented risk profile of raw milk. The broader context here is that raw milk is legal to sell in some U.S. states and illegal in others, and the legality landscape has been shifting. The regulatory debate is ongoing. What is not contested in the scientific and public health literature is the risk profile. Raw milk accounts for a disproportionate share of dairy-related foodborne illness. The pathogens it can harbor include Listeria, which is particularly dangerous for pregnant women and their babies, and E. coli 0157H7, which can cause hemolytic uremic syndrome, a potentially fatal kidney condition. The risk is not hypothetical. Outbreaks linked to raw milk occur regularly and are documented in CDC data. Cooking with raw milk can reduce risk in specific applications when the milk is thoroughly heated. It does not eliminate risk entirely and introduces cross-contamination exposure before cooking begins. For the general population, particularly for households with pregnant women, young children, elderly individuals, or anyone immunocompromised, the food safety guidance is consistent and evidence-based. Use pasteurized milk. New videos every day covering the food safety and nutrition topics that actually affect your health. Subscribe and stay with us. There is a cultural dimension to the raw milk debate worth naming. Interest in raw milk has increased substantially alongside broader skepticism of food processing and regulatory agencies. The framing is often that pasteurization is an industrial intervention that reduces the quality of a natural product, and that choosing raw milk is a return to something more authentic and less adulterated. This framing resonates emotionally in a way that influences how people evaluate the safety evidence. The factual response to this framing is straightforward. Pasteurization was developed in response to a real and documented public health crisis. Before widespread pasteurization in the early 20th century, milk was a major vehicle for tuberculosis, typhoid fever, scarlet fever, and other serious diseases. Pasteurization was one of the most significant food safety interventions in history, and is credited with saving an enormous number of lives. The instinct to distrust processing is understandable in some contexts, but pasteurization is not a case where processing degrades a food. It is a case where a specific, well-understood heat treatment eliminates a well-characterized set of pathogens with minimal effect on nutritional content or flavor. The processed versus natural framing does not determine whether a food is safe. Pasteurization of milk is a scientific and public health consensus, not an industry preference. The evidence for that consensus is 120 years of foodborne illness data, microbiological research, and epidemiological tracking. That evidence is not in dispute among the researchers who study it.